Hello and welcome everybody to the Clinician Veterinary Podcast. I am your host, Dr. Andy Roark. Guys, I got a great one today. I am here with Dr. Caroline Mansfield. She does a lot of things that I will talk to you about when she comes onto the podcast. But her main emphasis is in research on the interaction of the gut microbiome in health and disease in dogs and cats. And so I think she's fascinating. I think gut microbiome research is fascinating. I am really amazed and awed, as you will hear, about what we are learning about gut health and how gut health interacts with health in the rest of the bodies, and how basically every organ system can be tied back in some way, shape, or form probably to the microbiome and to gut health. And so anyway, we start talking about cognitive dysfunction and the role that the microbiome plays in that. We start talking about where prevention and treatment of a variety of illnesses might go in the future, and what research in gut microbiome looks like in that. If you just don't know much about sort of the gut microbiome research and why people are talking about it and why it's becoming a big deal in nutrition and general animal health, this is a great episode. I talked to her a little bit about the wellness industry and about the noise that's generally around nutrition and things like this, and how to kind of separate out what is worth talking about and what is not, and try to get our heads straight so that we can be a valuable resource when we talk to pet owners. So anyway, it is a sprawling conversation about a topic that I think is incredible. And so you will hear my wonder and excitement when you get into this episode. I hope you'll like it a lot. I have been thinking a lot about this episode since we did it. Anyway, that's enough. Let's get into this episode with Dr. Caroline Mansfield. Also, I got to say thanks to Purina Institute. They are making this episode possible ad-free for you guys. And so shout out to them. Let's get into it.
This is your show. We're glad you're here. We want to help you in your veterinary career. Welcome to the Cone of Shame with Dr. Andy Roark.
Welcome to the podcast, Dr. Caroline Mansfield. Thank you for being here.
Oh, thank you. You're welcome.
Oh, it is a pleasure to have you here. You had to get up really early for this podcast. I really appreciate it. You are, for those who don't know, a registered specialist in internal medicine. You are a past board member and president of the Australian and New Zealand College of Veterinary Specialists. You are the chief editor for the Australian Veterinary Practitioner. I could just keep going and going. You have You have over 90 peer-reviewed publications. My wife is a college professor. I don't know if people know how amazing that is. That is an incredible amount of work. You have supervised over 30 graduate students. You have done absolutely incredible things. And so I really I appreciate you making time to be here. I want to talk with you about nutrition. And right. There was something I was really sort of waxing philosophic about as I was sort of preparing for our time together, and I was thinking about having you come on and stuff like that. And so I've got this idea that we do not look at life and especially at medicine with the wonder that it deserves. And so I look around at our world, and I like just simple concepts like our physiology, our immune system. It is absolutely astonishing that we have this system that works as well as it does. And I think about so much of what we do in medicine, and we just kind of take it as, oh yeah, well we have this and we know that, and we know that the body works this way and that way. But I really don't think that we just look at life with the wonder that it deserves. And so, your research really focuses on the interaction of the gut microbiome in health and disease in dogs and cats. And so I'm thinking about this idea that the gut microbiome has this role that is so large and sort of ubiquitous through our body and through health in dogs and cats, but also in humans. And I don't know that people really process what that means. And so let me just sort of kind of open up here at a just a high level. Paint for me sort of a picture of how you look at the gut microbiome and sort of in its role in healthcare in general, if you don't mind.
Sure. So it's really, I guess it's kind of interesting that you talk about that wonder and that excitement about medicine and physiology. Like I feel super excited every time I learn something new about the microbiome or the way that it interacts with the body. I think it's an incredibly fascinating area. It's probably like having a whole other organism within an organism. So it has in interaction with virtually every organ system is affected by the gut. And the gut is, from an immune perspective, is probably one of the most important, important interfaces with the environment. The gut is usually where we are exposed to multiple antigens on a daily basis. So the gut microbiome influences that immunity, that immune system. It influences the way the brain develops as a child or as a puppy or a kitten, influences behavior, it influences kidney disease, influences development of uroliths. Like it's just, it's fascinating, all of the interactions that it potentially has. And probably what's even more fascinating is that, we didn't understand how much was there because we didn't have the technology to identify all of the organisms that were in the gut microbiome until recently. And even now, I still think we're a little bit limited in how we understand, or basic in how we understand, because I think each bacteria has the capacity to have different functions. And so there's this kind of redundancy or fail-safe system. So, it's not enough just to know what bacteria are there. It's what they're doing, whether they have their buddies there to help them or not. Like it's just super fascinating.
I completely agree. And I appreciate you saying that, that this is fairly new and coming to light, because it does feel fairly new. We didn't have this sort of insight when I was in veterinary school, and so I'm seeing this sort of research coming out, and I'm trying to get my sort of hands around it, and I'm thinking about it in a lot of different ways. So first is just my basic understanding of the physiology and how this affects my patients. But then also we start to get into therapeutics. We start talking about wellness care, but then we also start talking about addressing disease states. If you're talking to, I don't know, just say a doctor who didn't have a robust understanding of this coming out of vet school and has been sort of trying to catch up, how do you help veterinarians, veterinary technicians, nurses, how do you help them think about this microbiome just at a systemic level? Like if they say to you, this is all really new to me and I'm trying to get my head around it so I can start to understand and start to talk in a way that's helpful for my patients, where do you sort of start?
I guess I kind of... I don't know, to wax a little bit lyrical, I sort of talk about the fact that the microbiome it's not equally divided. It's not like good or bad, but to have a really healthy community, just like a healthy human community, you need diversity, right? And you need, the bacteria or the component, the participants in that community are doing different functions. And they're all contributing together to work towards a particular goal. So I guess the things that, we need to be thinking about is that when we are talking about nutrition, we can talk about, basic nutritional requirements like protein and carbohydrates and fat and so on. But we also need to be aware that any diet that we feed affects that community, and so if we want to enhance a particular function, I'm really loath to talk too much about particular bacterial species because I think, like I was alluding to before, particular bacterial strains or species will only be effective if other bacterial strains are present, and they do have a redundancy in their roles. And so I think it's better to think about the functionality. And so most diets provide some kind of prebiotics, which is kind of like a fertilizer, I guess, to promote growth and diversity of that microbiome. And we also have the capacity to influence it positively by using prebiotics or postbiotics, which are probably the new emerging field. So those are the metabolites that bacteria produce. But we also have the capacity to do it a lot of harm. So I think particularly with the use of antimicrobials indiscriminately, we often think, well, we're treating that urinary tract infection, or we're treating that ear infection, or pyoderma, but we're not doing absolutely no harm to the animal and the animal's microbiome when we use those antimicrobials.
When we disrupt that way, like when we use systemic antibiotic for cystitis or for and that's the classic one is we better safe than sorry, and so we use antibiotics when we have cystitis or even like a pyoderma that we could maybe treat topically and we don't. Talk to me a little bit about the recovery period. Like how does that manifest clinically? Like what is the fallout that we see?
So I think that's a really good question, and I wish there was a really simple answer, but there's probably not, because each individual microbiome is going to respond really quite differently. And even within an individual, their microbiome might respond differently at different times. I kind of use the analogy of an elastic band, right? And so if you've got a really healthy, fresh, new elastic band and you stretch it, so you give it some antimicrobial, so you disrupt it, you give it for a short period of time and then you release it, the elastic band's going to go back to normal pretty quickly. But the more that you stretch it, or if it's an old elastic band or it's a little bit sick, when you stretch it, it just doesn't go back as normal the next time, So it is highly individualized. And I think we probably don't, a lot of the analysis that's been done, a lot of the studies that have been done, the way that the microbiome has assessed probably doesn't completely answer that question. Because it doesn't completely answer the functional capacity. But we know that, for example, metronidazole has impacts for a very long time. We're talking, weeks to months after it's been discontinued. But again, it's really highly individual. Some animals will revert back to normal more quickly and some will take longer.
Yeah. I think about sort of looking at diets this way and sort of processing what the microbiome means, to overall animal health. And we've already got we've had pet owners for decades now who have been very attuned to what their pets are eating. They are very interested in the nutrition and what they feed their pets. It's something that pet owners can see. They have a feeling of control about what they feed. I can also see this being an area for a lot of confusion. I can see a lot of people, trying to do what's best for their pets and kind of heading off in a sort of misguided directions. Let's start to take this focus on the microbiome into a sort of a more sort of practical, clinical, conversation. How do we start to advise pet owners on diet selection and what's important? And what are the sort of the pitfalls that we might fall in, or areas where we might see pet owners kind of going off in a way that's not productive?
Yeah, I guess the part of the problem with the microbiome, or it's I guess the downside for its increasing popularity, is that there's a lot of increasing noise around about it, and a lot of noise about how to manipulate it, and that kind of corresponds with I guess that whole wellness industry that I think is being translated into the veterinary, into pet owners. Sure. They take themselves very seriously. I think we have the advantage with pet food, though, is that we can control what they eat to a certain degree. And I think as long as it's a well-balanced diet, and it's been proven, and the dog is healthy or the cat is healthy, there's probably not a lot of benefit in manipulating the microbiome in those animals. So the times, I guess, when we start to think about it are, once they've actually developed disease, and particularly gut disease. That's probably more when we know that manipulating the microbiome is likely to be effective. And also there's some emerging things that are happening, like with cognitive dysfunction in dogs and epilepsy, and manipulating the microbiome in those may be beneficial. And I guess also when we think about it, with some conditions like hepatic encephalopathy or, liver failure, we've been manipulating the microbiome for, half a century with lactulose. But we weren't really aware that's why we were doing it, right? So I don't know that I've actually answered your question very well, though. Sorry.
No, I think you did. I mean, I think you knew exactly kind of where I was going. Is the wellness industry is definitely spilling over into pet health, and this is when we start talking about gut microbiome. I hear this in the wellness industry all the time, of people talking about protecting yourself against Alzheimer's. People who getting joint health from the supplements that we take and things like that. And there are supplements that are hugely valuable and wonderful, and there's a lot that's not. But I think you put your finger right on it when I sort of said, I anticipate the noise of this. I hear a lot, and I don't mean to start a controversy about this, but there's a lot of people who put forward, raw foods or things like that, specifically because they say, oh, the microbiome is important, and this is a more robust way to increase diversity in the microbiome and things like that. And again, I'm not trying to start the raw food, not raw food debate at all, but it's just there were a lot of people have strong opinions, and so I think I just want to be. I appreciate you answering in sort of an even-handed way, because that's really what I was looking for. Is I want to have productive conversations about this and not just sort of jump to conclusions or overstate what is available and what pet owners need to look for in their food. So I think you asked it well. Are there? So the second part of my question was really sort of, how does this go off the rails? Are there areas of misunderstanding that you see where either doctors or pet owners sort of, they take part truths or they have sort of common misunderstandings or things that kind of derail these conversations?
I think personally, probably in my experience, not so much. I mean, I think I'm privileged that I work in a referral population. So normally the people are coming to me for advice, and so they usually are quite happy to take advice. It's interesting that there are some people that are very resistant to to some diet regimes, but when you start talking about manipulating the microbiome and that there are other ways to do that, so we can use prebiotics, we can use fiber, we can use probably not so much postbiotics anymore, like at this stage, they're not really developed, but we can use probiotics to a certain extent. I find that people are really quite willing to take that on board. They're probably not, if they're very set in their ideas about what they want to feed their animal, and I do come across those people, they have really strong beliefs. I tend not to try and work against them. I tend to try and work with them, and just to make sure that the diet is appropriate for the animal. If it's not, what else they need to have to make that appropriate, or if we can help in any way. But I tend to find if I'll alienate them if I tell them I disagree with them, or I think that their diet choice is wrong, and then you lose them, right? So yeah.
I think we've all kind of had to do that math at some point, and to say, is this the hill I want to die on, or do I want to continue so that we can we can work on the future?
Pick your battles.
Yeah. Definitely. Talk to me a little bit about where you sort of see this field going. I got to tell you, going back to sort of the statement of wonder I had at the beginning, when we start talking about the microbiome and its impacts on cognitive dysfunction, that's magical to me. Like that is so beyond what we ever used to think, and the idea that there's something we can do for cognitive decline or things like that is amazing. Where do you see this sort of research going? How do you see the science here manifesting out into healthcare, into actually treating dogs and cats in the future? What's this going to look like?
So, what I'd love it to look like. So there's a few things in the human field. So there's something that was called like the American Gut Project. It's a bit of a misnomer because they do get samples from around the world, but where they're basically screening screening people and looking for if there's geographical differences, seasonal differences, and so on. And we don't really know that well in dogs yet. Partly because of the costs of sequencing. So, a lot of it has been done with the method called 16S, which is takes the ribosomal RNA gene that's ubiquitous in bacteria, and then it amplifies that, and then you get your sequencing data. But it does miss a lot of stuff. Like it doesn't go down to a species level, and there's just a lot of noise that surrounds 16S. So using different methodologies is really expensive. It's coming down in price now, so it's probably more useful, but it's still expensive. So where I would love to see it is I'd love to see similar situations in veterinary medicine where we're actually tracking it, like we track cohorts of animals across the world, like different breeds. And we then are able to also track their health. And so we can actually see whether there's a preceding marker or a flag or a change in the microbiome that actually precedes the development of any clinical disease. And to me, that's where the magic would really happen.
Yeah.
So if we could, have it as part of our health check and we go, well, hang on, we're seeing this shift in the microbiome, and that suggests to me that, if we can intervene here, we may prolong or prevent the development of this particular disease. And that's where I think the real magic is going to come. But, that's a long way away, because we need to be tracking these animals and we need to be doing all of those and correlating them to the diseases. But, you talked about cognitive dysfunction. One of the cognitive dysfunction, can't talk properly, I'm getting too excited. One of the really interesting things with Alzheimer's disease is they have actually shown that changes in the microbiome precede any detectable change by 1 to 2 years in people.
Wow.
So I know, wow, isn't that amazing?
Well, think about, that is amazing. One of the things that we have going for us in veterinary medicine is, our patients' lifespan are much shorter, which is bad. But the beautiful part is starting to gain that type of whole lifespan knowledge. We can do it much faster than if you were following cohorts of people that started in their 20s and aged into their 80s and 90s. So anyway, this is super exciting. If people want to learn more, do you have favorite resources? Are there places that you would send veterinarians, nurses, even engaged pet owners? What do you like for sort of general educational growth in this topic? Yeah,
so the problem is that there is so much information coming out, right? So if you put microbiome in PubMed, you'll have 25,000 hits. So sometimes I think there is almost too much information. There is, I do find the Purina Institute, CentreSquare, they've got a lot of really good resources. They've recently had a Microbiome Forum, which I think it may still be available, online, of the recording, but don't quote me on that. So I think that breaks it down, and it also breaks it down quite nicely into sort of bite-sized pieces that are good for speaking to clients about particular conditions as well. So I think those resources are really good. For more general nutrition, I think the WSAVA, the World Small Animal Veterinary Association, has some amazing resources, so nutritional toolkits and diet history forms. They also run some modules on nutrition, which are free, which I think are really useful for vet techs and new grads to do as well. And then I guess it kind of depends on, what condition you're talking about. Yeah. Then you kind of go more specific websites. But I think those are probably good places to start.
Oh, I love that. I'll put links to the Purina Institute, CentreSquare in the show notes. If the Microbiome Forum is still up, I'll link to that as well in the notes. And then the WSAVA, I'll definitely link to that. And their nutrition toolkits are excellent, and their nutrition modules as well. So I'll put links to all that stuff. Yeah. Caroline, thank you so much for being here. I thoroughly enjoy talking with you. Where can people find you online if they're interested in you and your work and just kind of want to keep up with you?
So at the moment, I'm working at James Cook University, which is in far north tropical Queensland. So JCU Vet is probably the best link for that. It's a pretty cool place to be. It's just right near the Barrier Reef, and get to go snorkeling and then hop up and see some crocodiles. It's pretty cool.
That's amazing. Oh, man. Thank you so much for making time and being here. I really appreciate you.
No worries.
Guys, thanks for tuning in today, everybody. Take care of yourselves. Thanks for being here. And that's it. That's what I got for you guys. I hope you enjoyed it. I hope you got something out of it. Thank you so much to Dr. Mansfield. She got up before 6 o'clock in the morning, her time, to do this podcast, and that was wonderful. Thanks to Purina Institute for making this episode possible. Thanks to you guys for being here. And that's it. That's all the thanks. That's the thank you. Thanks to me for also being here. Thanks to my dog Skipper, who came and sat with me when I did the podcast. Thanks to my mom and my dad. And I'm just going to fade out. I'm just going to fade out on that, and that's where we're going to end the episode. Thanks so much, everybody. Take care of yourselves. Be well. Bye.